Great to have you along for the ride. Thanks a lot for stopping by. Glad to have this man back. He is, of course, a world-renowned cardiologist, epidemiologist. It's Dr. Peter McCullough. Doc, how are you? Good to see you.
Good to see you. You're moving fast today, Joe.
We're always moving fast. We're rapid fire on this show. You know that. You're always so quick with the responses, and we appreciate that because we get a lot in a small amount of time. Let's start with you speaking in front of the European Union. This is a big deal. Millions and millions of views. A, how are you invited there? And B, is Europe more open to the truth than we are here in America when it comes to COVID-19 and the vaccines and all this stuff?
I was invited to a session by German Member of Parliament Christine Anderson, a real freedom fighter. We had both a legal team and a medical team. I capstoned the medical presentation on the dangers of the COVID-19 vaccine, a biopharmaceutical complex, probably led by the WHO, World Economic Forum, but many NGOs as well as the regulatory agencies, all working with big pharma on pushing the vaccines. And I concluded with two major calls. The first one was remove all the COVID-19 vaccines from the market. They're not safe for human use. The present ones and then future boosters, is get them off the market. Second call was to pull out of the WHO. WHO does not help developed countries at all. And their Pandemic Treaty Alliance international health regulations are an overreach. It's a big power grab that's going to get us bound up in international law. We don't want any of that. So drop the COVID-19 vaccines, pull out of the WHO, and let's move on.
PeterMcCulloughMD.com is his website, sort of like a one-stop shop for all of your content, all of your information. You start there, you go anywhere you want to go. Go and do that. Doc, when they in Europe were questioning Pfizer, and there was some vice president from Pfizer that was on the stand, they asked this specific question: did you ever study whether these vaccines stop the spread or stop the contagiousness of COVID-19? And the answer was no. So our FDA, our CDC, our NIH all lied. The president, Biden, lied when they said, if you take this shot, it'll stop this. That should have shot everything out the window, shouldn't have? As soon as they sat down and asked that question?
Our CDC director came out, midsummer of 2021, said the vaccines don't stop transmission. Pfizer knew that all along. Never should have been a mandate. Now we learn in a paper by Michael and colleagues on my Courageous Discourse Substack, Michael and colleagues, it turned out that Pfizer had 38 additional deaths from the data cutoff point in November of 2020 to the FDA meeting in December of 2020. Wow. And those deaths occurred mainly in Pfizer-treated patients. And so the FDA committee was never updated on reality was a threefold increased risk of cardiovascular death. So if Pfizer would have been honest with the data, the FDA committee should have asked them for the additional deaths after the cutoff point and have an appendix in the briefing booklet. The Pfizer vaccine never would have been approved, Joe. It was bad from the start.
It's never really been approved. It's still EUA. There's never been any FDA approval. This way you can't sue the companies for all this stuff that they're doing. And emergency usage only or authorization should give me the ability under some sort of consent to say, yes, I'll take it, no, I won't. But governments and businesses and cities used this EUA and forced it anyway. Those two can't coexist, can they? EUA means I have the right to try it if I feel like it, but under informed consent, if I don't want to, I shouldn't have to. But as I said, cities, counties, states, the central government, or all forcing people to, or else their livelihood would be at risk.
Well, you've laid it out quite well. First off, the vaccines are government property. They're government property. So right. First off, they're not commercially bought and sold. You're right. They're not FDA approved. They are approved for emergency use authorization. That's how I was using that term. They're not fully licensed. Emergency use authorization prior to COVID was only for military mechanisms. It was used for anthrax, other vaccines. We've had 3 years now of emergency use authorization, government vaccines used publicly. It's never happened before. There should always be free choice, always be informed consent, and never have a mandate on something that's emergency use authorized.
It's Dr. Peter McCullough. Go and get his book, Courage to Face COVID-19. Go to his website, PeterMcCulloughMD.com, for all the links from there. Let me ask you about Fauci recently coming out and admitting something that you and I knew and that you and I talked about now for 3 years. He says, yes, there's an increased chance or risk of myocarditis in men, especially young men, because of the vaccines. But he couches it this way. Tell me if he's right. But there's a higher happenstance of myocarditis in men just from COVID-19. Is that true?
No, that's a false narrative. We knew from 2020, before the vaccines, that myocarditis was very rare with COVID. Big study from the NCAA Big Ten League. They found a handful of cases, no hospitalizations, no deaths, inconsequential. Tuvalia and colleagues from Israel showed no increase from the baseline occurs with Coxsackie and other viruses. U.S. military also dropped their screening programs. So we know myocarditis with COVID is very rare. And then with the vaccines, there was an explosion of myocarditis, thousands of cases reported to the CDC, fatal cases, paper by Holscher and colleagues. I'm the senior author, shows autopsy-proven fatal cases of myocarditis never happened with COVID. So Fauci, again, is misleading the public, trying to downplay COVID vaccine myocarditis. It's a killer.
It's the same guy that said he never forced mask mandates, and of course he did. It's the same guy who said he never suggested we shut down the economy or shut down the country. We've got video of him saying exactly that. How is this guy still getting $430,000 a year in his so-called retirement? And there's actually talk about him maybe facing legal charges. Would you be somebody who would support that, knowing that either he was completely inept and incompetent or he was lying on purpose?
You know, Fauci's never faced me in the U.S. Senate. He's been invited multiple times, advance notice. Now we learned the House Select Committee, Brad Wenstrup, just got this out on Twitter. Turns out that Fauci visited the CIA secretly early on in the pandemic, probably in crafting this false narrative. Remember Fauci, Francis Collins, Peter Daszak, EcoHealth Alliance, Jeremy Farrar at Wellcome Trust, Christian Anderson at Scripps, Edwin Holmes, Sydney, Rambrett. They were all part of that key meeting, January 2020, where they decided to mislead the world and say the vaccine came out of nature when they knew it came out of the Chinese biosecurity lab.
What's interesting about this is only a month ago, we had two more people in front of a House committee who literally said, I still believe it came from the wet market. It came from nature. And there's no possible way a bat bit a pangolin, whatever that is, and then somebody ate that and it spread to humans. The possibility, is there any possibility, Doc, in your opinion, even 1% that it came from nature?
No, it did not come from nature. In fact, Ralph Barrick at the UNC Chapel Hill with the bat lady Xingling Li, they published the papers together. 2016, Nature Medicine Proceedings of the National Academy of Sciences, they declared they created SARS-CoV-2. At the time, it was a biosecurity at level 3 lab. They said it was gain-of-function research, but it was grandfathered in under the pre-Obama years, and it's all U.S. funded. So it's clear, U.S. published research created SARS-CoV-2. It didn't come out of a wet market.
Follow him everywhere, Dr. Peter McCullough. PeterMcCulloughMD.com is the website. He's a great follow on Instagram, on Twitter, and everywhere else. I guess we're calling it X now. When it comes to what we were told and what we now know, quietly, I wonder if you saw this, and we may have talked about this before. I apologize if we did. But a lawyer for the FDA, under oath in some suit, admitted that doctors should be fully able to prescribe ivermectin. You know, the attack on ivermectin, the attack on you and me because we said ivermectin worked, which it does, was so ridiculous. And now even the FDA quietly, no big news sources ever even reported this. The lawyer said, we would never stop doctors from prescribing. You realize, Dr. McCullough, that even today, some pharmacies not far from me in San Antonio will not fill an ivermectin prescription, even today. What do you make of all that?
The FDA intentionally misled the country. In tweets, it said ivermectin is only horse paste, shouldn't be used to treat COVID. Now the lawyers, speaking on behalf of the FDA, said doctors can use ivermectin like we always can, appropriately utilized off-label use, community standard of care. Ivermectin is community standard of care. It's been in the McCullough protocol since 2020 and FLCC and other protocols. But you're right, the pharmacist followed the FDA's fraudulent statements on ivermectin. It all came out in court. Congratulations, Dr. Apter, Mary Terry Bowden, as well as Dr. Paul Merrick. They're the ones that took the FDA to task, and we do have it now, the truth out in the open.
What's interesting about off-label, this is how they try to sell it. They're making off-label a pejorative when, of course, it's not. And at the same time, they're complaining about ivermectin or hydroxychloroquine, which are effective therapies for COVID-19. They're also pushing off-label usage of drugs and calling them puberty blockers. These drugs were never intended to stop puberty or change hormones or to transition somebody. What do you make of that? They're pushing off-label big time. I mean, if you're against that, you're a transphobe, but you can't say off-label label for ivermectin and hydroxychloroquine.
Remember, the label is the original advertising claims of a product. I've been in sessions with the FDA. I've lectured at the FDA. I've been on FDA advisory panels. We agree that the advertising claims are irrelevant to clinical practice. The advertising claims are just what the drug companies want to do. Doctors use drugs according to the art and science of medicine. FDA has 2018 guidance on their website saying doctors should use drugs off-label when they're fulfilling an unmet need, and that's exactly what we did with COVID. You're right, it's a double standard, and the FDA has actually lost a tremendous amount of credibility in the physician eye.
I had attorney Tom Renz on last week. He said that the shots are not mRNA. He said they're Mod-RNA. He said mRNA would stay in your shoulder if that's where you put it. Mod-RNA goes through your whole body. Is there something to that? I'd never heard the term before.
Well, there is human messenger RNA, which your cells are making right now, Joe. It's very, it's made for each single use. It helps, create a protein from DNA.
Right.
And it's broken down by ribonucleases. So the messenger RNA of Pfizer and Moderna, it's synthetic because one of the natural parameters called uracil is replaced with pseudouridine. So it's synthetic. It's not broken down by human enzymes. The messenger RNA is widely circulating in the bloodstream. Paper by Castriuta showed this. Roltgen and colleagues from Stanford showed it stuck in lymph nodes for months. Now we learn that the spike protein produced from the messenger RNA is floating in the bloodstream. Listen to this, for 6 months at high concentrations. Paper by Brogna and colleagues from Germany. This is really bad. People have spike protein circulating in their blood, and they keep taking shots every 6 months. And so there is sustained circulation of this lethal protein devised in Wuhan, China.
PeterMcCulloughMD.com is his website. Go there. I want to talk in a little while about what people can do about those spike proteins that are floating around in their bloodstream and how they can use a therapy to get rid of that. In the meantime, though, I want to bring this up. The new variant is on the way. The mortality rate is very, very low. Even if it's 100% more than we saw in cases of COVID because of the new variant, that's based on a very, very low number, so 100% is not hard to get to. This new booster that Biden allegedly took the other day, but we weren't allowed to see him take it. What are your thoughts about this so-called new variant and the push by some for new mandates?
The CDC tells us the fall outbreak is led by EG5 and XL 1.5. I've already managed patients with this in my clinical practice. It's very mild, just some mild nasal congestion and no fever, no pulmonary involvement. We just use nasal sprays and washes, virucidal nasal sprays, gargles like Scope or Listerine. No prescription drugs are needed. I haven't had anybody near the hospital in many years now, Joe. No need for an XBB 1.5 booster because XBB 1.5 is nearly gone from circulating strains. And, Moderna's package insert now on the booster looks like it's just as dangerous, potentially even more dangerous than the previous shots.
And by the way, talking about taking a shot is something that was so completely premature. But when I talked to Renz last week, he said it's because the government already bought all the shots. So what are they going to do with them? So they literally are pushing every day from the podium in the press room. Every American should get this booster. You're saying they shouldn't?
They shouldn't. Recent paper by Roche and colleagues. This is shocking. 34.9% of healthcare workers are so sick after these boosters they can't go to work the next day or day after. These are very toxic shocks. They should not be administered. I've called on the floor of the U.S. Senate December 7th, 2022. Pull all these vaccines off the market. They're not safe for human use.
It's PeterMcCulloughMD.com. It's Dr. Peter McCullough. So let's talk about those who are concerned. Last time we spoke, it went viral. I pulled out the one part where you gave the therapy for what people should do if they're worried about the boosters that they've taken, the spike proteins that you just alluded to, 6 months in the bloodstream at very high concentrations. But there is a way to take care of that. What is it that people should do?
There is, a recent paper by Diexner and colleagues from Germany. Joe, the vast majority of long COVID patients, it's because they've taken the vaccines. It's not due to COVID, it's due to the vaccine. So even long COVID, the problem is COVID-19 vaccination. The virus is getting milder, by the way. Long COVID is getting less frequent. But the people with the lowest rate of long COVID is unvaccinated with Omicron. But having said that, if people have had multiple episodes of the infection, taken multiple shots, all the studies show that they have spike protein stuck in their tissues, potentially circulating in blood. 3 things are known to help here, and they provide a basis of care. Can't make any therapeutic claims. Large trials are not done, but here they are. Nattokinase, 2,000 units twice a day, bromelain, 500 milligrams a day, and curcumin, 500 milligrams twice a day. It's in a publication. I'm the first author, Journal of American Physicians and Surgeons, also on the European Commission preprint server. It received tons of downloads. It's called Base Spike Detoxification. Again, nattokinase, 2,000 units twice a day, bromelain, 500 milligrams a day, and curcumin, 500 milligrams twice a day. One of the best-in-class products is Spike support from the Wellness Company. That's nattokinase plus 5 minor ingredients. So I tell you, we've got a solution now, and the vast majority of people are doing it, and we're seeing progress. It takes about minimum 3 months. I saw patients today, severe neurologic case. It's been about 5 months, and she's turning the corner.
I think that's great. You and I both work with the Wellness Company. People can go to my Linktree, linktree.com/Joe Pags, and click on the Wellness Company. It takes you right to this page. Read up more about it, and it's supported by Dr. McCullough. One last question that people constantly ask me, and I don't know the answer. Is shedding really something? I'm not vaccinated. I didn't take any shots. If I'm around somebody constantly who took all the boosters, is shedding something I should worry about?
At the level of the spike protein, it looks like everyone's been exposed to it. There's multiple seroprevalence studies. We all have antibodies to the spike protein. I rarely find anybody in my clinic who has no antibodies to spike. So we've all been exposed to spike through the infection, some through the vaccine, and many through both. Now, having said that, what you're really worried about is actually shedding of the messenger RNA itself. Right. Now, 2 papers, Joe, one in Lancet, one in JAMA, showing messenger RNA coming through the breast milk of women, pregnant women who have delivered, ill-advised, they took the shots. This does not look good. It must be in body fluids. So we don't know how much messenger RNA is being transferred. I've interviewed on my show Helene Benoun from France, former INSERM scientist. She's convinced it's happening. It's probably close contact. People have asked me, well, if my spouse or partner has taken a shot, there may be a risk in the first 30, 60, 90 days. I'm telling people if they can, try to forego close contact for about 90 days, and hopefully the body starts to shield it.
Always perfect advice. Get his book called Courage to Face COVID. And it's Dr. Peter McCullough, petermcculloughmd.com. Doc, thanks a million. Let's do it again soon.
All right. See you soon.